Dr. David Borenstein is redefining functional medicine for patients who have run out of options. For many patients living with chronic illness, the healthcare journey becomes a cycle of frustration. They see specialist after specialist, move from prescription to prescription, and still leave without real answers. By the time they arrive at the office of Dr. David Borenstein, many feel defeated. The first thing they often tell him is simple: "You're my last hope." For Dr. David Borenstein, that responsibility is not intimidating. It is exactly why he practices medicine the way he does. When you have a patient that has been to 10 doctors and they come to you and you make them better, he says, that is the greatest feeling of accomplishment. As the founder of Manhattan Integrative Medicine and a leading voice in functional medicine and integrative medicine in South Florida, Dr. David Borenstein has built a practice around helping patients who have not found relief through conventional healthcare alone. His work focuses on identifying the root causes of chronic illness rather than simply suppressing symptoms. Today, patients from across Florida and beyond seek out Dr. David Borenstein for conditions including chronic fatigue, fibromyalgia, autoimmune disorders, hormone imbalances, thyroid dysfunction, gastrointestinal conditions, mold exposure, and complex inflammatory illnesses. A medical career built on looking deeper drive, David Borenstein's path into integrative medicine did not begin in an alternative medicine setting. His foundation is deeply rooted in traditional medical training. He earned his medical degree from the Technion Faculty of Medicine in Haifa, Israel, completed his internship at Staten Island University Hospital, and trained in physical medicine and rehabilitation in New York. It was during his residency that he encountered a patient suffering from fibromyalgia, a condition that many physicians still struggle to treat effectively. What stood out to him was not only the patient's pain, but the lack of meaningful solutions available within standard treatment models. Rather than accept that limitation, Borenstein began researching emerging approaches to chronic disease management. He studied physicians working outside conventional protocols, explored functional medicine methodologies, and pursued additional training in integrative medicine. Eventually, he joined an integrative medicine clinic in New York, where he began applying a more comprehensive, patient-centered approach. The outcomes changed the trajectory of his career. "I felt I was onto something," he recalls. That realization ultimately led to the creation of Manhattan Integrative Medicine and the expansion of his work into South Florida, where he continues helping patients navigate complex chronic health conditions through personalized medicine. The functional medicine approach at the center of Dr. David Borenstein's philosophy is functional medicine, an approach that seeks to understand why illness develops instead of only managing symptoms after they appear. Traditional healthcare systems often rely on short appointments and symptom-based prescribing. Functional medicine takes a different path. For Borenstein, every patient evaluation begins with a detailed health history, comprehensive blood work, symptom analysis, lifestyle evaluation, and a close examination of potential underlying causes. The objective is not temporary symptom relief. The goal is identifying dysfunction at its source. Personalized, patient-centered medicine that identifies the root cause of chronic disease rather than just treating symptoms, is how he describes the approach. This model has become increasingly important as more patients search for answers to chronic conditions that do not fit neatly into conventional diagnostic categories. Patients seeking functional medicine treatment in South Florida often come to Dr. David Borenstein after years of unresolved symptoms. Many are dealing with issues such as Hashimoto's thyroiditis, hormonal imbalance, low testosterone, menopause-related symptoms, PCOS, IBS, and digestive disorders, chronic fatigue, fibromyalgia, mold and mycotoxin exposure, autoimmune disease. These are conditions that frequently require a more comprehensive approach than standard symptom management alone. Treating the whole patient. One of the defining characteristics of Dr. David Borenstein's practice is the amount of time and attention devoted to understanding the full picture of a patient's health. Patients are not viewed as isolated symptoms or lab numbers. Instead, Borenstein evaluates how nutrition, sleep, stress, hormones, inflammation, environmental exposure, gut health, and lifestyle habits may all contribute to chronic illness. This whole-body perspective is one reason many patients seek out integrative medicine physicians when conventional care has failed to provide lasting results. Borenstein also recognizes that many modern patients arrive highly informed about their own conditions. "Many of my patients are already experts," he says. Rather than dismissing patient research, he incorporates it into the clinical process. His role, he explains, is to combine medical expertise with a deeper understanding of each patient's individual experience. That collaborative dynamic has become increasingly important in functional medicine, where long-term outcomes often depend on lifestyle modifications, nutrition changes, supplementation strategies, and sustainable treatment planning. Experience that extends beyond conventional medicine. In addition to his board certifications in physical medicine and rehabilitation, Dr. David Borenstein also earned certifications through the American College for Advancement in Medicine and the American Academy of Anti-Aging Medicine. He is also certified in medical acupuncture, further expanding the range of therapies available within his integrative medicine practice. His professional background includes publication in the European Journal of Ultrasound as well as serving as chief investigator on a spinal cord injury research project. This blend of traditional medical training, research experience, and integrative medicine expertise has helped shape the clinical model he uses today. According to Borenstein, effective chronic disease treatment requires physicians to move beyond rigid medical silos and examine the broader systems influencing patient health. That philosophy has become increasingly relevant as healthcare providers across the country reevaluate how chronic illness is treated. Why functional medicine continues to grow. The rise of functional medicine reflects a broader shift happening throughout healthcare. Millions of Americans are living with chronic illnesses that are difficult to resolve through symptom-focused treatment alone. Conditions tied to inflammation, hormone imbalance, autoimmune dysfunction, gut health, and environmental exposure continue to grow more common. Patients are also becoming more proactive. They want physicians who listen carefully, investigate thoroughly, and look beyond surface-level symptoms. Dr. David Borenstein believes this demand will continue reshaping medicine in the years ahead. The current model is simply not working for many patients with chronic disease, he says. Integrative and functional medicine is the wave of the future. That perspective is increasingly shared by patients seeking personalized healthcare solutions that address long-term wellness rather than temporary symptom control. A different kind of medical practice for patients who feel like they have exhausted every option. Finding the right physician can become life-changing. That is ultimately what defines Dr. David Borenstein's work. His practice is not built around rushed appointments or one-size-fits-all protocols. It is built around investigation, personalization, and understanding the complexity of chronic illness. For many patients seeking functional medicine in South Florida, that difference matters. Because when someone has spent years searching for answers, being truly heard is often the first step toward healing.